Thank you very much, Dr. Lamy, for the excellent presentation. I've just one question regarding the counseling or the patient counseling you give to a post-bariatric surgery patient when he or she leaves the hospital, before leaving the hospital. What are the, if I ask you, give him 3 or 4 main points to go home or take home with him as regard patient counseling.
هو البيشنت كونسلنج بالذات في البارياتريك سيرجريز من غير بقى الكومبليكيشن اللي احنا تعرضنا ليها، هو مين اللي بيبقى انكلودد معانا نيوتريشنال، طبعا نيوتريشنست فارماسيست، بسبب ان هو مين
هم حالا دلوقتي هيطلعوا دلوقتي بالظبط.
دكتور لميا I want to emphasize apart from the nutritional aspect, the drugs. You advise the patient which drugs you can take and which drugs you cannot take, and the formulation, which formulations are allowed to be given to this patient, and what are the formulations that will be affected by the surgery.
هو يعني mainly بيعتمدوا اول ما بيخرجوا ان هو بياخدوا supplements nutritional، فبيبقى mainly لو في IV formula هي بتبقى most preferred، او اللي هي السبلينجوال formulation زي مثلا الفيلمز بتاعت الفيتامين بي او الكلام دوت. الاورال بقى بيبقى يستحسن ان احنا كنا بنقول ان انت ريفير لي الاول عشان اقول لك ده زي ما احنا شفنا هل الكونكور اقدر استخدمه فعلا في الفتره، او الابيكسابان زي ما شفنا اقدر استعمله في الاكيوت اتاك ديت ولا لا، ولا لازم استنى كام اسبوع ونبتدي تاني الدراجز يعني تاني.
تمام، يعني you give him clear instructions. Do not take any drug except after referral to the doctor.
Yes.
Like for example, enteric-coated tablets, slow release tablets. All these formulations are contraindicated.
عشان الابزوربشن بتاعها بيكون متاثر جامد جدا بعد العمليه.
Do not take any except after. Thank you very much. Thank you.
معلش يا لميا ارجعي تاني. دكتور جيسيكا عايزه to ask one question.
So I would like to ask you a question. Thank you for your presentation, of course.
Okay.
According to beta blockers, what is the drug of choice? I mean, you use bisoprolol. What about carvedilol, nebivolol, the third class of beta blockers? With yes, if you recommend, or if yes, what cases? Because they act well on lipid levels. This is the third class of beta blockers. Yes, nebivolol, carvedilol. Of course, bisoprolol also recommended in heart failure. It's perfect. But if there are cases when you recommend the third class of beta blockers, carvedilol, nebivolol.
Actually, I didn't research about this agent. I already only searched about Concor or bisoprolol, because the patient, it is one of her home medication before the surgery, and it was the first line agent for us.
Yes, oh, that's okay, thank you. And also another short question, okay. Okay. And another short question about digoxin, because you said you recommend to some patient digoxin, yes? Yes. And we know it has neurotherapeutic index, yes? And especially we notice in our cardiology department patients who have too low potassium level are most sensitive. So if patient at discharge, if you recommend to continue digoxin, if you put patient attention to control, to not stop potassium control, because any case of hypokalemia increases toxicity of digoxin very much. Yes. As patient education, yes, because I noticed in community pharmacy when I was practicing that some patients, when they have lots of drugs, they start to think, oh, this is too much. Maybe this I don't take, this I don't take. And once I had the case that there was potassium and digoxin, and the patient said, oh, it's too much drugs. Potassium I don't need. So I said, yeah, you need control, because it's in the case of too low toxicity of digoxin, it's getting much higher.
Yes, so digoxin, one of our major medication that require an important patient counseling on this charges.
Glucose monitoring. Yes. Thank you very much.
شكرا يا لبنى. بداية بقى الموضوع البرياتريك سيرجري، احنا معانا بقى الاكسبرتس بتوع النيوتريشن، دكتور باسانت ايهاب هتكلمنا ان شاء الله عن الاوبيزيتي مانج اند السوبرفيجن اوف دكتور دعاء اسامه المر والتيم بتاعهم الرائع نيوتريشن تيم في الكسندريا مين يونيفرسيتي هوسبيتال. هتكلمنا عن الاوبيزيتي مانجمنت في الكاردياك بيشنتس ان شاء الله.
Good morning, everyone. It's of course my honor and pleasure to be part of this exquisite conference, and I hope you get beneficial of our talk. If you're gonna start at first, we all know that obesity causes a lot of comorbidities, and one of its major comorbidities are cardiovascular diseases, by causing hypertension by 51%, myocardial infarction by 21%, and ending by strokes by 3%. So, of course, we have to understand the major role of obesity management in cardiovascular disease patients. As we all know, it's the #1 major mortality causation worldwide. Causing by obesity management techniques, it can lower the mortality by 15% and more, and it can reduce cardiovascular diseases by 10 to 15%, and prevention of type 2 diabetes and NAFLD by 5 to 10%. So if we can go through the measurements or our successful strategies to cause intentional weight loss, we have to understand and put in our mind 3 major strategies, which are causing a lower caloric consumption, increasing physical activity, and modifying unhealthy behaviors, which is gonna be one of your professor answers at the end of the presentation about the behavioral techniques that should be interchangeable between us and the patient and educate them about it. So we have to understand as well, if we're gonna go through intentional weight loss techniques, we have to understand 2 major problems, which are stress reduction and sleep environment improvement. And why is that? Because a lot of papers have talked about those role in both cases to cause a lot of weight regain and cause also cardiovascular disease. So it's very important to educate them about those both techniques. So if we are gonna understand as a nutritionist, we have to know what are the normal weight loss range, which is a very common question asked between a lot of patients, of course. We have to understand that it is from 0.5 kilos of fat to 1 kilo per week, either through weight reduction measurement, which we're gonna discuss it in the next case, or through bariatric surgeries, which cause a major weight loss at first due to the loss of water retention a lot, but afterwards, the weight loss measurement or range, it can be the same range as well after like a month or month and a half from the surgery. So if you're gonna start by our first case, which is AK, which is a housewife having 58 years old with a height 170 and weight 120. The major problem with the case was that it can suffer from an uncontrolled arrhythmia, uncontrolled thyroid, although it is on medication, uncontrolled elevated liver enzymes along with pancreatitis, having or suffering from having prediabetes state and high insulin resistance, along with kidney stones, and of course the requirement of a major orthopedic surgery. So if you're seeing here in our paper that it is very important to understand that in older obese patients, weight loss measurement or programs causes both enhancement in the cardiovascular state of the patient and also enhance the physical activity of it. And also we have to understand that long-term lifestyle intervention change in the patient causes as well reduction in the type 2 diabetes case, or even having a chance to have a diabetes, as in our case, of course. So it's very important to educate the patient at the end of the sessions to understand and have a responsibility about changing her lifestyle, and that is because that she has to understand as a patient that changing her lifestyle will also change and enhance her medical condition. So if you're here, see the echo, we will see that the patient have or suffer from left ventricular hypertrophy and grade 1 diastolic dysfunction. So, of course, as a nutritionist, clinical pharmacist, we have to understand our role very well, which is the first thing for us was drug-drug interaction, which was the test was run on her, and thank God she doesn't suffer from such thing. Drug-food interaction, which was done to her by having a customized diet, which was, of course, the main diet of pleasure for us for such case was Mediterranean diet, which was, of course, the best one for her case, and also enhance her medical condition, along with having an in teamwork, along with the orthopedic, endocrinologist, and gynecologist as well. To see in here, we started from October 2023 and until May right now, we see enhancement in the home IR, in the thyroid function, and we see enhancement as well in her HbA1c, vitamin D, and cholesterol level. To see the major thing between for such case is that the lot of medication she took previously to end up with this one at the right side, to see the best outcome we can go through such case, along with only weight loss. And through, of course, normal diet, along with eating all the kinds of food she can take, to see a weight loss happening from, as you can see in here, 120 kilos, started with 62 kilos of fat, to end with 106 to 50 kilos of fat, and she is continuing on this weight loss. As you can see, the progress, of course. So if you go through bariatric surgeries, we have to understand that bariatric surgery is the choice for such normal patients having suffering or from a lot of problems. At the primary state, having cardiovascular diseases and NAFLD, of course, or having a criteria of having BMI 40 plus or 35 with a lot of comorbidities, or history in the patients who had a lot of dietary interventions and turned out to be failed. So such patients, we have to understand that we put them under our consideration to have a bariatric surgery. So as an example for such case is HK, which is a young man, 27 years old, unemployed, suffering from weight by 183, or it was 160, and previously by a year 183 kilos, and along with previous history of only having one cerebral stroke, which caused him to have a slurred speech, and he was only on Clexam medication, and the only lapse he suffered from was having a small amount of oxalates in the urine. But the main problem with him, that the echocardiogram shows that he was a normal person, but as a clinical nutritionist, clinical pharmacist, we asked to have a genetic profile which has shown that to have a positive gene mutation for MTHFR gene, which of course, under the supervision and the recommendation by the cardiologist, he suggested that he must go through an urgent bariatric surgery to prevent multiple strokes to happen for him again, which happened for his patient. And of course, as a nutritionist, clinical pharmacist, it's our role very mandatory for such cases. Starting with, of course, the intervention, having contribution in giving education for the patient to enhance ARIS programs, including a diet plan pre-surgery, during surgery, and after surgery. And of course, to educate the patient about what to do during such thing. As you can see in here, it was very important to start with a liquid diet, which starts from the second day of surgery to end with the third or fourth day, along with start with semi-solid and puree diet, and along with ORS supplementation, of course, to the patient, which happens with this patient in the hospital. And afterwards, soft food starting to from the 5th or 6th week, and it can start from the 8th week as well, according to each patient, of course. And along with regular small meals or snack, which can start from the 6 weeks, but it's obviously according to each patient's state. We evaluate his state, and accordingly we start the plan with him. As we can see in here, the patient had normal labs. The only thing was with him that the vitamin D was deficient. So our action plan, or the education for the patient that he has to go through as a take-home message with him, to educate him about the new portion control tips, that this is the new meal style and this is the new size of the stomach, as well as to enhance his exercises. For our case, he enhanced his exercise by going to the gym actually 6 times per week. And of course, we educated him about both dumping syndrome, which is happen if we eat and chew very fast, and also if we eat sweetened food as well at the start. And ending, for such patient, he did not usually know how to chew well in his case. And why is that? Because he had slurred speech problem. We educated him about it, and of course to lower the intake of sugar, popcorn. We finished. احنا خلصنا. Okay. And if you can see in here, we educated him about not taking fizzy drinks, because he used to have a lot of fizzy drinks as well. So we educated this about him to exchange it along with fresh food, fresh juices, sorry. And as you can see in here, the progress happening to this patient, as he started from the previous years by 183 kilometers and kilograms and 105 as a fat percentage or fat kilograms. He have to end with 105 kilos and 48 kilograms of fat, and he is continuing to weight loss, as you can see the progress in here. And these are our references we have used, and thank you.